Hello, my name is Mitchell Heber. Welcome to my YouTube page here. I wanted to make an updated video on how my TMJ is going and what my phase 2 is all about. So if you caught my first video, this is going to be part 2 here. Part 1 I talked about basically getting started with my treatment with TMJ or TMD. If you're not familiar, TMJ stands for temporomandibular joint. It's a joint within your jaw joint. And TMD is the proper term for basically what the dysfunction is. So it stands for temporomandibular dysfunction, and basically what that is, it's a dysfunction in the jaw joint. So people who experience this, it is caused from many different reasons. It could be caused from braces at a young age, which is kind of my case in particular. I also had 2 adult teeth removed from my mouth. They're next to the canines. And I believe that was part of why I was, how I developed TMJ. I had braces for the first time around when I was probably 12 years old. I was in middle school, and the whole TMJ thing happened for me when I was about 19. Started waking up with all this pain in my jaw. There was this major popping and clicking going on, and it was very, it was very uncomfortable for probably a good couple months. And then the kind of pain started going away, and then I was just left with this popping and clicking in my mouth. And it was really unnormal, and I got really concerned about it, got really curious, so I started doing some of my own research, figuring out ways I could, take care of this problem. And I got a couple of opinions from your traditional dentists, and they told me nothing was wrong. They took x-rays, they said everything looks fine. Obviously, from my perspective, I'm like, my jaw is popping and clicking, there's something wrong here. So it definitely wasn't normal, and I just went on with my life, figuring this is how it's going to be. Finally, a couple of years later again, just last year, I got introduced to more of your holistic alternative dentist doctor, and he finally gave me some answers on how I can fix my TMJ. So for anyone who has those symptoms or experiencing this, I just want to let you know that there is an alternative, there is a way to fix it. However, it's not going to be your most favorite and or cost effective to take care of this. However, I look at my health as an investment, not an expense. So I just want to explain a little bit more on how this can happen. So again, my particular case was from braces and having teeth removed at a young age. I also believe that there was some trauma caused from injuries that helped develop my personal TMJ, as well as maybe some stress that I was going through at the time. There could be other reasons. Some people think there's some genetic reasons why you develop TMJ. However, each is their own, I think, on how it is caused and how it comes about into your particular case. So with that said, I saw this guy named Dr. Preble in American Fork, Utah. They've done an amazing job, and what they've done is give me what's called a neuromuscular orthotic device. I've been wearing this for about a year now, since my first video when I first got it put in. It was very uncomfortable, it was very hard to talk at first. However, I've adapted over this past year now. I feel like I'm speaking pretty good, and I'm going to take it out. It's kind of gross. Just so I can show you what it looks like. And it's just this little piece of plastic. It's a little gross right now. And I also want to talk about some things that you can do to make sure if you decide to do a treatment like this that you can actually come out on the positive side of things. Every case is different, so definitely talk to your doctor. I myself as well had some twisted C2 in my neck, basically just some misalignment within the body. And throughout my treatment with the neuromuscular device, I would see a chiropractor first thing in the morning prior to getting my adjustment with my orthotic. And what that would do then is, get my adjustment with the chiropractor. That'll help align everything. And then I go see Dr. Preble, my doctor, for the orthotic, and he would make the adjustments on this piece here. So I started coming into alignment, basically, is what was happening and what I was feeling. I'm a snowboarder. I've had shoulder injuries, other injuries, and I've really felt the alignment of my body throughout this entire process. I could feel muscles moving in my face, in my shoulder, and overall I became stronger because of this whole process. Even though it's been a long process, and now I'm starting phase 2 here soon, which unfortunately now, because this orthotic basically realigned my jaw is now positioned differently. And the good thing is I don't have any popping and clicking, but unfortunately now because my jaw is repositioned, my teeth don't match, they don't line up fully. So if you actually look, if I take a bite down, you'll kind of see that my back teeth actually don't touch. So that is because my jaw's realigned. So now, unfortunately, phase 2 for me is getting braces again, which, because I have this particular orthotic in my mouth, the process with braces is actually going to take longer. It'll be closer to the 3-year mark, which I'm not stoked about. However, the goal is to get myself fully aligned again, get this orthotic out of my mouth permanently, and really just live a full, optimal, aligned, healthy life. And again, I look at my health as an investment, not an expense. So with that said, if you're anyone out there who has TMJ or is experiencing TMJ symptoms, consult a professional who can help you figure out what's the best move for you. And if you have a more serious case like me and you need braces long term, definitely find an orthodontist who is specialized in working with TMJ patients, because my doctor recommended me to my orthodontist now. They do a lot of work together, and I feel like I'm in really good hands, and everything has gone really well. Again, my jaw's healed, it's fixed. I feel amazing, stronger than ever, and now I'll be starting phase 2, getting my braces on here in the next couple weeks, as long as everything goes well with the pandemic and the shutdowns and all that stuff going on right now, unfortunately. But with that said, stay safe, everybody out there. If you have any questions or concerns, you want to talk to me more personally, I'd be more than happy to help you or give you some feedback or answer some questions for you. This has been a long process for me, and I'm grateful that I'm able to get this fixed and handled, especially at a young age. I'm 26 years young now today, and to get this handled now long term, I'll no longer have to wear that orthotic. That'll get removed completely, and shouldn't have to wear braces ever again after this whole process in the next few years. So follow along. I'll be doing an updated video again once I start the braces process. Thank you all for joining me again, and have a wonderful day. I love you. Keep smiling. God bless. Talk to you later.